Okay, it's not 2 o'clock CET, so I think we will start on time for the participants who already joined. So welcome everybody to our panel discussion today on the flood response in Pakistan, where we'll discuss what the response can tell us about the future of humanitarian action. My name is Yannick Créoff. I'm the fund coordinator with the H2H network, and I will be moderating the panel discussion today. For those who are not familiar with the H2H network, very briefly, it's a network of NGOs who provide specialized services and technical resources to other humanitarian actors as a way to increase effectiveness, quality, and accountability in humanitarian action. Just to let you know as well that the session is being recorded, so we'll put that on the H2H website later on. So perhaps let me start by giving a bit of background to our discussion today. In June last year, Pakistan experienced an extreme monsoon season with the scale and the severity of the event being exacerbated by the climate crisis. As a result, over 33 million people were affected by the disaster and 8 million people were displaced. As a middle-income country with substantial disaster management capacity, the Pakistani authorities led the humanitarian response with, of course, the active support of the Pakistani civil society. However, challenges around mounting and facilitating a large-scale response quickly emerged. It's in that context that the H2H network activated its fund to enable some of its member organizations to support the wider humanitarian response by providing specialized technical support and resources with a focus on communication and community engagement, as well as inclusion in humanitarian action. The objective of our discussion today will be to take stock of the humanitarian response to last year's flooding and to identify some key learnings and reflection on how we can establish and manage an effective humanitarian response in a context which is affected by chronic climate-driven natural disasters, and where the traditional internationally led humanitarian system is not in place. To help us with unpacking these complex issues, we have 4 speakers with us today. I will introduce them one by one. First, we welcome Anwar Sadat, who is a humanitarian inclusion expert with LPage International. Anwar is leading health-based project to improve the inclusion of persons with disabilities and older persons in humanitarian action in Pakistan. Anwar notably coordinates the Age, Disability and Diversity Task Force, which brings together UN agencies, NGOs, and organizations of persons with disabilities. Outside of Pakistan, Anwar has worked on humanitarian inclusion with HelpAge and with the Global Protection Cluster in major crises such as Yemen and Ukraine. Welcome, Anwar. We also welcome Alice Castillejo, with communication and community engagement expert with Clear Global. In Pakistan, Clear Global implements a project which aims to address the language-based exclusion of diverse communities by collecting and analyzing data on the geographical distribution of minority language groups, as well as the barriers that these communities face to access information and assistance. Alice has over 20 years of experience in the humanitarian and development sector and currently leads Clear Global's work on issues such as PSCA and climate change. Welcome, Alice. We also welcome Dr. Shafak Munir, who is a research fellow and policy analyst at the Sustainable Development Policy Institute in Islamabad. Dr. Shafak specializes in human rights, disaster risk reduction, climate change adaptation, and sustainable development. He has experience in leading advocacy initiatives and strategic campaigns on diverse humanitarian policy issues across Asia, and has worked with multiple UN agencies, INGOs, and research institutes. Welcome, Dr. Shafkat. Last but not least, we welcome Asma Salim, who is a Deputy Regional Representative for Asia and the Pacific with ICVA. Asma is based in Islamabad and has over 10 years of experience in the humanitarian sector. In her role as Deputy Regional Representative for Asia Pacific, Asma provides support in setting the direction of ICVA's work in the region in terms of strengthening the meaningful participation of local NGOs in humanitarian coordination, emergency preparedness, and partnership development. So welcome to all 4 of you, and thank you for joining us today. So let me start by a first question, which I would like to address to all of you. Is simply what was unique about the 2022 floods in terms of the scale and the severity of the needs, but also regarding the capacity of both the government and humanitarian actors to address those needs. So Dr. Shafkat, if you'd like to answer first.
Okay, thank you very much. As we all know, that this time the flood was not as we witnessed in 2010. Though it was not less in scale or less in damages, but the nature of the flood was different. And that is why this time the unique thing we needed for the humanitarian response was rescue of the people from out of water. Because the water came from because due to the locally generated weather system within the south, within south, that created this situation. And that is why even after many months, water was still standing there. So that was the unique thing as compared to the other emergencies of floods in Pakistan. And that's for that what we needed at that time, and which could not be abundantly available in terms of response and rescue, was that we needed boats. A lot of boats were needed, but they were not in plenty, which were required, looking at the massive scale of the disaster, to lift people out of that, even with the NDMA, PDMA, and privately. Some of INGOs with the military and with PDMA could manage it, but had we had enough rescue equipment, we could have saved more people from destruction. Today, the World Malaria Day report has been released by WHO, and Pakistan with Malawi is among the two worst hit countries due to malaria, and that is because of the flood-related water, standing water in these areas. So I think that's a very grave situation. And to answer your thing, to your question, the unique thing was a unique response that should have been started from a rescue which was needed through the rescue equipment which was not abandoned. So that created loss of damage and disease among the people. That's a brief answer. Then we can discuss more on that.
Thank you, Dr. Shafka, for like pointing out the importance of rescue operations and the fact that the floods were not receding. Can I turn to you, Asma, and ask you, from ICVA's perspective, again, what was unique about the needs, the scale, but also the response and how it was shaped and coordinated?
Yeah, thank you so much, Yannick. And before I start off, just a little bit about, ICWA, in case some of the people or who are not aware of what ICWA is. It's basically a network of NGOs, local NGOs, international NGOs, and networks of different forums and countries. And we are, I think we have a membership of 150 international, local, and network organizations all around the world in 160 countries. And we aim to have more principled humanitarian response, and that's what we thrive on. From our perspective, from ICWA perspective, because we are actually based in Geneva, but we have regional hubs, and as a part of deputy regional rep, this is one of our tasks to kind of monitor and look after the countries within South Asia Pacific, where we see there are emergencies arises, and I think Pakistan has been always been one of the parties countries within ICWA because of its highly vulnerable geographic and climatic conditions, and it's always I think according to the global climate risk index, Pakistan is the eighth most vulnerable country regarding the climate change and extreme weathers, and we have seen this in the last year as well. In terms of what was the unique, I can imagine you all have seen the reports. One third of the country has been totally under the water. still the water is there, like Shafkat already mentioned, that the scale and the impact, it has, it's not only the economic, it has health problems as well. There has been economic and political instability already in the country. Then there are, because of the post COVID economic situation, things has been very haphazard as well, although it was a government led response. But again, government was totally overwhelmed by the response and the capacity and the scale of this whole response. And of course, the humanitarian actors, they tried their best to kind of accommodate, and there were private and there was like individual donors as well who were kind of work into this humanitarian response as well. However, because the landscape and the way the humanitarian actors has been and their scale down in the Pakistan from the last 3-4 years, that really impacted, how the response were before. There were huge issues on the coordination side, on the collaboration side, how it goes, because there was no cluster system that has been active. There were working groups because that was the phase which Pakistan was in. There was no OCHA last year as well. There was like a small satellite office which is called like HAT, Humanitarian Advisory team, that was there. That really impacted and really changed the response as well. And I think many of the humanitarian responders who are actually working in the Pakistan can already relate that still coordination is a huge issue, and the needs are still there. The response is again, it's still, it was supposed to be recovery time, but still there are organizations who are still responding to the immediate need, in especially in the very hard hit district in Sindh and Balochistan provinces. So this is the overview of what we have been seeing. And from the ECWA side, we have been coordinating at the national level with the forest to see how we can improve our coordination at the national level and at the district level, and how we improve those coordination at the regional level, at the Geneva level as well. I'm stopping here, and
Thank you.
over to you, Yannick. Yeah, just looking at the watch. Thanks.
Thank you, Osman. You pointed out to so many like important issues around like the scale of the response and how that overwhelms the capacity of the government, but also of like traditional humanitarian actors who had been scaling down in the year prior to the disaster. Perhaps Anwar, can I ask your views, your overall analysis of like the crisis and the response?
Thanks, Yannick. Couple of points already covered, but I just want to mention that normally the floods in Pakistan, it happens from the Indus River, but this time, as Shafkat mentioned, that it was mostly like from the local rains. So when we were meeting with different community members and organizations of persons with disabilities, we came across one interesting story that an older person in Muzaffargarh, one of the province in Pakistan, he mentioned that this time the flood will come and affect these villages. So he mentioned that it's 100 years repeat. So it will be different kind of rainfall and different kind of effects and issues. Many people, they make fun of him, and they of course related to different myths and all that. But after that, it happened the same way. The local rain was too much, and at the end, different villages was submerged. So we are very young to say that, but I mean, it was related to something repetition of this kind of pattern after 100 years. And of course, like climate change and all that is part of it. The other thing was unique, like as Asma and Shafkat mentioned as well, that it was government-led response. But we felt like we were at a point that, I mean, of course, like disasters are not planned. So it comes suddenly, and it was very too much in its scale. So I think we were not at a stage that where we have divided our roles and responsibilities, that what the disaster management authorities will do and what the coordination structures will do. Of course, like the clusters were not activated, there were different working groups only available, and they were still coordinating with the government authorities and asking for their provisions to do like initial rapid needs assessment, the coordination, and no objection certificates and all that. Then the other unique thing that we found is that it's a resource allocation against the losses. The losses were too huge, but we didn't see like that much funding was raised to meet all those needs. Due to that, as Asma and Shafkat mentioned, that there was too much stagnant water, and then say, for example, when we talk about more marginalized communities like older people and persons with disabilities who lost their mobility aids, assistive devices, older people who need of non-communicable disease medication, for instance. So those were, as we were involved in advocacy with different working groups, government authorities, so those things were very least priority because we were having very limited resource allocation, and we were looking at like provision of other food items and non-food items and different other things. And those things were actually there to support and improve the accessibility of different vulnerable groups and access to services. Those were not the priority of any working group or any other funding agency, for instance. So that's something we felt like it was unique, and it was at the end was like affecting differently to different vulnerable groups at the end. There are many other things that will be shared in maybe in the coming discussions, but I will stop here and over to you, Yannick, again.
Thank you so much, Anwar. And I think, yes, we will definitely come back to like the gap in the response that you highlight in terms of how the limited resources impacted prioritization and therefore perhaps overlooked the inclusion of vulnerable groups and communities. We'll come back to that in a minute. Before we do so, can I turn to you, Alice, and again ask you sort of like overall analysis of the crisis and how the response was led and coordinated.
Yes, thank you. And I think I will also be touching on some of the issues of marginalised groups. So our technical niche is that we're a language and communications specialist organisation with a focus on trying to make sure that marginalised language speakers and people who experience language barriers are not excluded from assistance. What was really interesting in this response is that very many times in humanitarian emergencies, what we see is that there's a poor awareness about linguistic diversity. But in this case, that wasn't true, although we found that in Pakistan, the response leaders, national leaders and civil society leaders were actually very aware of the language and communication barriers. And that there was what the struggle was about operational approaches and guidance to address those barriers, not the actual issue in itself, which was really positive, I think. What we found was that responders brought to the table the challenges that they faced regarding managing Pakistan's enormous language diversity and addressing communication barriers. And so along with supporting them to kind of raise awareness of this, perhaps for the international actors, we focused on operational solutions to help responders move from awareness to action. So for us, it was quite a different place to be working than it is in many responses. Obviously, Pakistan has a very active civil society, which was very important for us in the way that we operated in this particular context. So, with a very active civil society and working with a very outspoken and confident local organisation who have done many decades of work on flood response, what it allowed us to do was to work with Patan's political analysis of the dynamics of information flow and the accountability mechanisms, which informed the analysis of the data that we were getting in our joint research with them, and made the learning and resources really relevant and actionable for national and local government authorities and civil society. So I think that was a really important piece of kind of collaboration and learning for us as well. I suppose from our point of view, the other thing about having this particular context was it made us think about how in this way we can work from a distance. We're a relatively small remote organisation, and we were able to support humanitarian organisations from a distance rather than doing direct implementation. We do our one technical specialism around language and communication. We do very well, and we were able to bring that support to other responders. And this collaboration, as I was saying, with a very outspoken, confident civil society partner helped us really streamline and collaborate within the wider structure of the response, which I think was something quite unique for this. So for us, it was really interesting. Thank you.
Whereby essentially like Clear Global provided just like technical expertise and support to, as you said, very active experienced and outspoken, as you say, like, civil society, and just providing those technical resources and experience and backup. Anwar, can I ask you, you also work for an international NGO, HelpAge International. Can I ask to speak on to how you adapted, HelpAge sort of like global programs to the context of Pakistan, and how you worked with local civil society to promote a more effective and inclusive humanitarian response?
Thanks, Joe. So I was leading Aging, Disability and Diversity Task Force, as you rightly mentioned before. So this task force works basically globally. These kind of task forces work under protection cluster. But in Pakistan, as we were not having a cluster, so we were working in collaboration with the National Protection Working Group. Civil society that we were engaged in was included Pakistan Humanitarian Forum, that's a network of international organizations, then National Humanitarian Network, and of course, disaster management authorities like provincial disaster management authorities in Sindh and Khyber Pakhtunkhwa, and also organizations of persons with disabilities, and then there is a network called Aging Network. In terms of adopting our response to local context, of course, Pakistan is diverse in terms of culture and languages. And the first thing that we adopted, we make sure that whatever we are communicating, whatever packages we are offering, are culturally contextualized and available in local language and accessible for different kind of audience, including people with different types of disabilities. In Pakistan, after the flood, we started an initiative making inclusion a reality in flood response. So members from Pakistan Humanitarian Forum and NHN, they were sensitized on, say, for example, collecting inclusive data and making their programs inclusive for older persons and persons with disabilities. And we were able to identify some clear gaps within the humanitarian response. And this is where H2H then helped us in terms of bridging those gaps, because one of the things that most of the people were asking, that what is the key global guidance, or what is the framework or standard that holds us accountable to make sure that older people and persons with disabilities are involved. And this is where, with support of H2H, we had a series of capacity building trainings. And this is another unique feature of the response, that like most of the donors, they were focusing on in-kind support, and we received funding from H2H for this capacity building trainings. We were able to reach out to 58 organizations of persons with disabilities and 84 humanitarian organizations working in the flood affected areas. And then we try to make it institutionalize whatever we are doing in collaboration with provincial disaster management authorities. For example, from all those events that we conducted with different international organizations of persons with disabilities and aging networks, those were at the end came up as standard operating procedures for inclusion of older people and persons with disabilities, endorsed by provincial disaster management authority in Sindh. So I think that was the one thing that was key in terms of promoting effective inclusive humanitarian response, because now we have standard operating procedures available for different humanitarian actors. The other thing that we felt like sometimes we, due to all that theoretical knowledge we have, we get very much oversensitized and we start practicing very simple things. So what we did with all those 56 OPDs and humanitarian actors, that we have different kind of WhatsApp groups. So we created WhatsApp group and we were coordinating with simply from those groups. So say, for example, one example, UNHCR was conducting an exercise, and we just sent into the group, and people, they volunteer themselves. And then another NGO, they were doing another research. So we coordinated them at the local level. So the overall action, I think, helped us in terms of bringing those people who are really at the ground, at the grassroots level, and they have limited representation. Because the other thing in Pakistan is that we have different kind of networks existing. So for OPDs, there are different networks, and the people who are really affected at the ground, ground, they get less representation at the, you can say, federal level. So from this action, we were able to identify those who are working really at the grassroots level, and we were enabled to bring them at the front, like at the platform of Aging, Disability and Diversity Task Force, from where they can actually coordinate with the UN agencies, government authorities. We have one representative from the field who represents us now in the Contingency Planning and Provincial Disaster Management Authority. So this is, I think, is the brief answer. This is how we contextualized our response, and we were able to make it more effective and inclusive response. Over.
Thank you, Anwar, and I think that illustrates really well the role you've played by like serving as a connector, like between like grassroots organizations, civil society, and like the more like higher level international humanitarian response and agencies, while bringing the global standard and applying those to the context of Pakistan. So thanks for that. Alice, you spoke earlier about the work you've done with Pattern Development Organization. Can I ask your reflections on like working with civil society in Pakistan, and again how you adapted Clear Global's approach and support to the Pakistani civil society?
Yes, absolutely. So our project was split into two components. In the first one, we mapped data about language use and flood risk and mobile phone communication infrastructure, and that developed operational language maps. So that really was about creating a tool which will help responders to plan effective communications in this flood recovery and in future emergency responses. So that was looking about sort of effective communication and language marginalization and making some sort of operational maps. The second component was the collaboration with the Patan Development Organization, in which we worked to understand the reach and the comprehension of the information materials which were being created by flood responders. And that was really interesting. Obviously, Patan Development Organization has been working since the early 1990s on flood resilience work. So they're an organization with a long background in this. What was really useful, especially, was the level of the relationships that they had with the communities that had been affected by the floods, and that allowed us to do qualitative research, which I think was very rich in its findings. But also, as I was saying a little earlier, the fact that they had those relationships meant that they also had insights about language and communication that was far beyond the technical expertise that we were able to offer. And we were able to get insights about community perceptions and about the power dynamics related to communication and information landscape that people faced even before the floods hit. So this enabled us to get recommendations which are really practical and contextual for that particular sort of set of relationships, and between the people and flood responders. And I think perhaps take some of the things that people generally know about effective communication and make some much more specific, detailed ones which apply to those communities and the way they were understanding and struggling to access different kinds of information. So I think that has been, that for us, was a really interesting way of working together with civil society. Thank you.
Thanks, Alice. So I think we've talked quite a bit of inclusion in the response, whether it's like age and disability related or through communication, as you just did. I think we can also like zoom out and try to take a bit of a bird's eye view on the response and see a bit what are the learnings that we can take from last year's response. So can I turn to you, Dr. Shafkat, and ask, from your perspective, from where you're standing, what do you think we can learn from the humanitarian response to the 2022 floods, especially when we compare last year's response to previous responses, such as response to the 2010 floods?
Thank you, Hanek. Very interesting question. If we see the response, I have a couple of points noted down to answer your question. Number one is that the response was, and whatever has been committed to Pakistan, even in response to the UN appeal, it is generally known as the finance. It is a response financed by debt. It is not a support. It's not an grant as we witnessed in 2010. In 2010, we had inflows coming in over $3 billion. But what has happened this time is only 267 million, which is a peanut. And even if you look at the follow-up action, what World Bank has done, they did not give anything new. They repurposed the loan. They repurposed the already loan which was on Pakistan. So that cannot really help for a response. Similarly, IMF, they did nothing on that. Rather, they grilled Pakistan at the moment when we are facing lot of troubles, and they had their conditionalities. You already have seen. So, in a nutshell, we can say that this response was a finance by debt. Secondly, if I would refer here the Geneva conference, Resilient Pakistan conference in Geneva this year, early this year in January. What has happened there? Over 9 billion dollars were committed, but all of them are loans, not aid. So that's a problem, because that could not be and that even not materialized. Only a few million dollars came into the immediate action, which we certainly provided that. That's why this is called a response by debt. Secondly, inadequate climate and anticipatory financing, because Pakistan has built the case at Sharm el Sheikh. I was also there with the government team. We have built the case with the G77 plus China, and that this is a climate driven kind of disaster in Pakistan, and the world accepted it. Even the UN Secretary General in Pakistan accepted it, and we together built a case for climate loss and damage fund. And that is why I was part of the PDNA also with planning ministry. That is why this time at PDNA we have calculated separately the loss and damage. Total is 30 billion. We redefined it, 14.9 billion in damages and 15.2 billion in losses, because we built the case. Now the case is there. But this realization is should be more when we will be meeting in UAE in the COP28 at the end of the year, when there is only fund set up, but there is no mechanism who will fund it, how it will be funded. And we rejected the argument at COP27. I mean, not mean the Pakistan, rejected the argument that this cannot be financed from the earlier available climate funding, because that is a different thing. It is loss and damage. It should be dealt with as a loss and damage, not from the climate fund. Now this fund is there. We have seen that it is all debt driven kind of things. Secondly, the argument that Pakistan is a middle income country. In my study, which I have done with the humanitarian outcome, we have seen this aspect, because you see it should not be the principle that a middle income country who have a system in place can really meet a big scale disasters. So that doesn't correlate either scientifically, or research doesn't support, empirical research doesn't support it, that if it is a middle income country, the aid should not come there. So the aid should be diverted as and required as per the humanitarian needs of the country. So that's the second thing on this side. The third thing is that climate and anticipatory financing. Now, this sort of financing, global warming, that's a phenomena, and nobody knows that what happened next in few years in Pakistan, in Malawi, or in other part of the countries. So that would also be a situation where we need to be ready about the anticipatory financing, which is caused by climate change, but loss and damage should be given a priority. This is an example. You asked that what is the learning? The biggest learning is that the money for humanitarian aid for such a big disaster should come on the not as a loan, but should come as a reparation from the for loss and damages. So that's an important area. In one word, if in one sentence, if I say on the anticipatory financing thing and inadequate financing, I would rather structure it that the 22 floods is a climate-driven disaster which meets declining humanitarian resources. So that's my punchline for that. The third one is the poor preparedness. I have just completed for Pakistan a report, midterm Sendai report on the Sendai framework. Pakistan, after the 7 years on, has submitted this report to the UN, and this report will be presented at the high-level meeting next month by the Prime Minister. So I finished that study in Pakistan context, and reviewed what Pakistan has done so far in 7 years. This report I have done for NDMA and onward to the government of Pakistan, and that also speaks about lot of things that we were not well prepared because of this situation. Though initially after 2010 flood, Pakistan spent enough money for preparedness, but later on, even the early warning system, our interviewees, our respondent, they talked about that they did not get the in time real time signals or early warning signals or with clear messaging. That's why they could not evacuated from their places, and that's why they were stranded in the water. So their preparedness sort of things are also problematic here, because our almost um, majority of the respondent say that poor preparedness was the cause of this sort of destruction. There was flood, but if they would have been prepared earlier, as I said in my first response, that immediately rescue was should have been equipped by the proper rescue equipments, boats and other things. So that's also thing. Then there was a reduce. This point, fourth one is very important. My other colleagues also talked about Asma, Anwar, and LSU talked about that also. The thin presence of INGO and NGO. My study also says that because the local players were the immediate responder this time to the community, but unfortunately they were not trained. They were not trained to rescue. They were not trained to distribute how disabled special people could be taken care of, how elderly people should be taken care of, how women and children and their needs should be taken care of, in as compared to 2010 flood. 2010 flood we saw. I was also part of the humanitarian operation. We have prepared because with us were international community. With us we were the international experts who know how to respond in such a situation. And this time, local people, they were collecting money from their own resources, local resources. They were just feeding them. They were just reaching them with food, medicine, and small things, but not really rescuing them, rehabilitating them. There was no concept of psychosocial care, which was we witnessed in 2010. Because in such a situation, these kind of things are important. So NGOs and INGOs were very thin, because INGOs were not allowed during last 2 years. Over 100 INGOs were asked to go back and packing. And they were asked that they will be given 6 month permit. So why they will maintain their contingency stocks here if they have to come only for 6 months? So for a regular response and for a situation like in Pakistan, which is still there, and in coming year also, there should be contingency plan under the DDMA process at district level by the government, by NGOs, as previously we handled very nicely the 2010 flood, 2011, 12, and 14 floods. So these are the glaring example which really this time we could not match it. Thank you. There are more points, but I realize the time constraints are there. Okay,
Thank
Yannick.
you. Thank you, Dr. Shafkat, and we can come back to some of the issues around climate financing and also damage in the conclusion, perhaps. And your sentence around response managed by debt will certainly stay with me. So thanks for that punchline, as you say. You also spoke about contingency planning and preparedness. Asma, can I turn to you? You work on Pakistan, of course, but also like across Asia Pacific. Can I ask from where the work you're doing with IGVA, what are the key operational and policy issues that you see emerging at the regional level around preparedness and anticipatory action?
Yeah, thank you so much, Yannick. And I think Shafkat has given a list of issues which I have actually listed. So I might skip some of the description, but I think Shafkat has really given us some very deep-rooted issues within the Pakistani context and also at the regional level as well. I'll just continue on the Shafkat point on the inadequate funding on the preparedness and anticipation action, because this is something which we are not seeing at the Pakistan level, but other countries as well. Since Pakistan has been one of the priority countries in terms of the preparedness and contingency planning, and I totally relate to Shafkat's point on having a very limited, giving mandate to the humanitarian actors, because back in 2010 there was a plethora of international organizations, local organizations have a very enabling environment to kind of operate in Pakistan. But now we see that in the last for 4 or 5 years there has been policy change, there has been the whole change of environment for humanitarian actors to kind of operate, that really limit their response at the country level, at the national level as well. Just looking at the issues, one of the thing during the last 7 8 months, which we have heard from the NGOs, because since ICWA is representing local organization, international organization in the Pakistan context, regionally as well. One of the things which we realized during our conversation with NGOs were there has been a very gap between what's happening at the federal level and what's happening at the provincial level. Some of the people who know about the 18th Amendment, where the provinces have their ability to kind of operate independently in the response. They have come across very challenging situations, not only to access and been operating at the working in terms of the operations, like getting the NOC, although government has provided like exemption for 6 months to kind of operate with the extended NOC, but that relaxation was not that was not translated at the provincial level. That was one of the challenge NGOs has faced during that time, and still they are working on the NGO on their registrations, paperwork that really kind of delayed the whole response as well. And that it was really that the situation when I went to see back in October, things were very bad, and the main question was coming from the having more collective voices, not having more coordination platform, because it was very haphazard. There was no cluster system that really, and nobody was prepared to work with the working groups. The forums which help, like for example, National Humanitarian Network and Pakistan Humanitarian Network, these are two leading networks in Pakistan. They try their best to be coordinated with government, with UN agencies, and with local organization as well. But the capacity, and of course, like my colleagues already established, that the scale and the intensity was too much for them to kind of operate in this situation. Again, a coordination and a collaboration, I think that is something which is one of our mandate as well as an ICWA, to kind of have more better coordination, because that's what we actually work with the local forums and with our members organizations as well. And this is the issue that we are working with to have more capacity strengthening with the forums, with the local organization as well. I think I'm just taking one of the comment from Anwar regarding the local representation, and this is something which we are very keen of, and this is one of the ICWA's transformational agenda as well on the localization, that we must ensure that local representation has to be at the regional country level, regional level, at the global level as well. And this is something which we keep on promoting at the regional level as well. And again, as we know that localization is becoming very buzzwords, and very everybody's taking that name, but it's really important to have that meaningful conversation on how we make sure that local representation, local communities has those representation at the right platforms, because this is what we have seen at the federal level as well. Some of the organization I come across, which we are members as well, they said that there has been a disconnect with the federal level coordination and with the provincial level and district level coordination. So that was something which definitely we are working with the forums as well, to make sure that there are platform for them to have that voice, and also kind of have more collective influencing and collective advocacy as well. And again, forums are very much important in this scenario, since the capacity and the scale, and we can easily predict project forecast in this year as well, that flood will be happening in the next few months. What would be the scale? What would happen? That again is a challenging thing. And I think one of the things that come now is the having more advancement in the preparedness side, and also, you know, utilizing technological and innovative tools as well, because that's very important. You know, like Shafkat mentioned about, you know, having more adequate funding. That is, of course, very important, not for the Pakistan only, but that the region as well, because we have seen the investment on the preparedness side is very much low. Anticipation action is again totally dependent on the funds. Another important point is regarding the collective capacity sharing. Like Shafkat mentioned, that local communities are very much important in the capacity building. It's not about, you know, government. It's not about just training in the rooms. It's much more more than that as well. And it's important to kind of realize different levels of capacity sharing. You know, where we would want government to, you know, take away from the past experiences and learn from that, and also with the organization, like local organizations as well, how they make sure that the local communities have enough capacity, because it's all about resilience. You know, it's always about, you know, collective effective humanitarian response. And if we eliminate the population who's totally affected by these challenges, I think we won't be able to make it, because this happen again and again as well, because we have seen the climate is not stopping it. Another point, which is on the loss and damage, which Shafkat already mentioned, I think I will be making that point later on. And that's again something which is a bit confusing and very, I say, in fancy as well, because nobody's actually know about loss and damage. Nobody's know how to approach those climate funds. It's all very much new for our region, specifically in Asia Pacific as well. And I think with some of my colleagues, if they are operating in Africa region, they also can relate, because this is something which is not happening in in Asia Pacific, but also happening at the Africa region as well. Yeah, thanks.
Thanks, Asma. And I think, like, since the beginning of our conversation today, I think like there are three sort of like overarching issues that keep sort of like coming back and that emerge. One relates to the nature of the response and the funding, and where the money is coming from. We talk about that and how we're not able to tap into other sources of like climate-related financing. And we spoke, or you spoke rather, about the lack of like focus on inclusion of specific marginalized vulnerable groups because of precisely the lack of resources, and therefore how the response has been prioritized and therefore overlooked those issues, and as well the specific challenges around the coordination architecture. So those are like some key three issues that sort of emerge. As we approach towards the end of today's session, and as a way to conclude before we open up to questions from the audience, you just said, Asma, that of course the nature of disasters in Pakistan is cyclical, right? It happened in the past, it will happen again in the future. And the climate crisis is gonna, if anything, worsen that phenomenon. So gonna ask, as a way of conclusion, to all of you, in that context of cyclical natural disaster, increasing severity of the climate crisis, what can be done to help Pakistan best prepare for the next upcoming crisis? Your top, like, 1, 2, or 3 sort of like, highlight recommendations. Can I first turn to you, Anwar, for your suggestions?
Yeah, thanks, Yannick. So one exercise is going on these days. It's contingency planning. Shafkat referred to that as well. It's with provincial disaster management authorities. But how much civil society, especially international actors, are involved into that is a question. Like then when we make the relevance, and when I was speaking before as well, who will do what is something still a question mark. But I think strengthening that contingency planning is the key, with the involvement of civil society and those actors who are really on the ground, like organizations of persons with disabilities, older people, and other actors as well. The other thing that we learned from our learning, need to be strengthened for the future, is the data. The data, for example, especially data on different types of disabilities, is not available. We were not having that in our census as well, although the recent census, those included the questions on different types of disabilities, but we are still not sure because it's something between the people who are collecting the data and people who are giving the data. If both are not trained, of course, we are not able to collect that data as well. So strengthening that data is the key. The other thing that was the lesson learned as well, that as I mentioned before as well, we were not having that kind of division of responsibilities, that who will do what. If it's a government-led response, then where is the responsibility of humanitarian actor lies? We missed few things between that as well, especially in terms of having impartial, neutral, and transparent response. For instance, there were many districts who were notified as fully affected districts, and those were not fully affected districts as well. So those kind of things will emerge, and therefore I think that moving forward, for effective response, we need to know that who will do what if there's a government-led response. And then again, like, we do many things, but we lack in documentation. So if it was the government-led response, maybe we built the case by documenting some good practices, that what went well from this government-led response and what needs to be improved, so that we can have better response for the future. I will stop here, I think. Thank you, Yannick. Over.
Thank you so much, Anwar, for those 3 points around contingency planning and the importance of data.
You are not audible, Yannick. Yannick, you are not audible.
Sorry.
Yeah.
Is it better now?
Yeah, better
Is it
now.
better now?
Yeah.
Okay. Sorry, apologies for that. Apologies for that. Fix the tech. Fix the tech. Okay. Good. All right. So Alice, can you hear me? Yeah. Okay. Alice, can I then
now, yes.
ask you for your sort of like key reflections and recommendations for how Pakistan and civil society can best prepare for the next crisis?
Yes, indeed. I guess we have 3 main points which came out from our research and our relationships that we built during this time. So the first one, I think already was being somewhat made around data. There are between 60 and 80 languages used in Pakistan, but there's no effective data set to capture all of these. And without that, it's very, very difficult for responders to be able to do an adequately nuanced communication strategy. So good language data is really fundamental. The 2 other points are around inclusion. The first one is that there are several policies and initiatives in place where they exist on paper, but not yet in practice. So helping responders to implement them would greatly improve the ability for people who face language and communication barriers. For example, the 2010 Disaster Management Act states that women and marginalised groups should be included in all stages of disaster risk reduction and management. And the Supreme Court also ordered that in Sindh province, female-headed committees for recovery and rehabilitation should be formed, but neither of those have been consistently and completely implemented. So community-to-community early warning systems are also being identified, but our research found that that material was not being shared with communities at risk of floods that were in a way that was easily comprehensible for people. So there are some kind of really practical operational gaps which could be filled. The final point which our partner raised was a really valuable point about the risk of elite capture of the localization resources, which is relevant not just for this response, but I think in many contexts. So we in the international community obviously invest a lot and talk a lot about localization, but actors who represent the most marginalized groups face the highest barriers to finding out about localization practices, being included in, and being able to engage in localization. So when it comes to language, a local partner who is comfortable using English and whose staff have time and capacity to engage with long, complicated written information are much more advantaged and are seen as a reliable partner. But actually, for localization to be really successful, it needs to work for the people most excluded, and that includes community organizations who don't operate in that way. So I think those were the three things for us which were real takeaways. Thank you.
Thank you, Alice. And since you were discussing about the different types of like civil society actors between like English-speaking NGO type organizations versus more like grassroots community organization, can I perhaps like link that with ICVA's work and turn to you, Asma, for your final recommendations on how Pakistan and the Pakistani civil society as well as government can best prepare for the next crisis?
Yes, thank you. And I'll be brief on that, since I'm just looking at the time. I think one of the things which we realize, and I think which my colleagues also pointed out, is us about having more focus on the affected population and amplifying the voice of local communities. That is, I think that's the baseline, and that's one of the lesson learned for us. Because we like Alice mentioned, localization is become like a buzzword for all of us. So it's important to be more accountable to the affected population. That is the extremely important point for all of us. And I think to achieve that, it's important to have more coordinated and strengthened voice for the local organizations and local communities. And I think that that could really help if we kind of invest more and strengthen the local networks to ensure that we have more collective voices and better coordination for the next floods to come. Another important thing is, like, for example, already Shafkat mentioned about the development approach, like PDNA. There has been this assessment has been done. There are 4R already been developed, and UNDP has been investing a lot on that. And I think it's very important to see humanitarian and development approach side by side, rather than putting them into different silos, because it's really important to think beyond the humanitarian response as well. And nexus approach, I know that it's very infancy again. It's again one of the buzzword, but I think it's really important to have that strong understanding, because if we do not understand something, we are unable to change anything. To make sure that we strengthen something, so it's important to have better understanding and have more collaborated and coordinated approach toward the better humanitarian and effective response. Thank you.
Thanks, Osma, for pointing that out. And Dr. Shafkat, you were talking earlier about the 4RF framework as the no funding and operational plan that replaces a flood response plan. So Dr. Shafkat, can I perhaps invite you to conclude this session with, again, your key sort of forward-looking recommendations for how to best prepare Pakistan for the next crisis?
Thank you, Yannick. First of all, I would like to agree Asma, Alice, and Anwar for the input they have given. I would not repeat that. So straight away, I'll give some of the concluding kind of points which could be helpful in the future response. First, I would like to summarize here, or in a one sentence, would like to say is that shock response, social protection, and humanitarian cash. Because in Pakistan's response, that has been a big issue for the first time, because Pakistan has an experience of disbursing cash through the Benazir Income Support Program, which we provided after the COVID-19, and similar thing was repeated here. But now there is a need to revisit that cash disbursement thing, which has been useful. But this was again a one-off kind of a cash disbursement, which was for immediate needs, but for a response to rehabilitation and recovery and full reconstruction, that's a full area where we have to have a full-fledged 4RF policy, which is already in place, backed by the resources. This is one point. Second, what we felt here was lacking is health, wash, and shelter. In this response, these were the lacking things. I think they should be improved. And the INGOs or the international players, those who are trained in these areas, they should be allowed to train the local communities and local organizations to handle these kind of things if in future any emergency hit. Third is protection, gender, and exclusion. These should be addressed properly, and it should not be just one or two paragraph in any policy. There should be a clear cut protection policy, gender policy, and inclusion, or what to talk about, not talking about exclusions. So that should be a policy oriented thing. Fourth, as Alice also broadly mentioned about this, I also agree on that. the information in emergencies. That's a key area, because if your message is not clear, then your early warning system fails and people are trapped into such kinds of emergencies. Fifth is finding the right role for international humanitarian actors in government and local society led and local led initiative. Because as I earlier mentioned, had people were trained in the local communities, this mess would not have been created, which we have seen now as compared to 2010. So there should be an enhanced international humanitarian role, which should be clear. Government should support it, and community should get the support from international communities, not only in terms of money, in terms of expertise, the expertise in physical or in terms of policy level things. So these are a few points on which I would like to conclude. Thank you very much.
Thank you very much, Dr. Shafka. I'm aware that we are running out of time, but I think it's important to open up for questions from the audience, whether that's colleagues who are present in person in the room or online. So feel free to, if you're online, unmute yourself and ask a question to our participants, or raise your hand, or for colleagues in the room, you can approach my colleagues who are physically present as well. I see, colleagues, so we have a question in the chat from Khalil.
And we've got a question in the room as well.
Yeah.
Do you want to take the one in the room first?
Yeah.
Great, go ahead. And start by introducing yourself.
Sure. Hi, I'm Ben Noble. I'm interagency coordinator for the IAC Task Force 2 on accountability to affected people. I'm just wondering around the question of corruption and transparency in general for local authorities, as well as the general disbursement of goods. I'm wondering if one of the things that should be looked into for next time, or to build preparedness, is also a public database of things that are pledged and distributed. Not only what is distributed, but what is pledged and given to government or other entities. And I'm just thinking of an example, which is that there was some tents that was sent to the earthquake in Turkey. That could have replenished some contingency stocks and things like that. So just wondering for the panelists, the question around transparency and public database for those items.
Shall I?
I would like to answer the question around transparency, funding, different sort of aid items being sort of collected and thereafter distributed.
Shall I respond to this question?
Please go ahead, Doctor.
And also clubbing another question, which is from James SB, which is in the chat box. And that also talks about the cash response. Yeah. Okay, so I'll club both and I will try to give an answer. Well, when there is a humanitarian response, in our experience previously and now, the transparency issue always comes into that, because accountability, transparency, these are part of the system of humanitarian aid. But since for the first phase, which is an immediate phase, for that always monies are given with some sort of not that kind of a M&E kind of mechanism, but it was for disbursement for food and immediate need. For that, always there has been issues and problems. But this time for immediate thing, what happened? All payments were made through cash and online cash. It was a disbursement. Let me give you the information. Under the Benazir Income Support Program, 2.7 million flood affected households were reached, and an amount of $115 per family was immediately provided, not as cash, but that was given to their account, and they withdrew from their wallet or the cash card. So that's why there the irregularity was reported. Not that money did not went to their account, but somebody who is their relative. For example, all money under the Benazir Income Support Program goes to the women-led household or the women of the household, both ways. So maybe women cannot or may not operate the account or withdraw money from cash from the card, and that some relative might have taken money. And there were some reports that some of local agents, they got money for withdrawing for them from the banks. These kind of irregularities were reported from the field, because I have extensively worked for my study in the field, and lot of local people, they reported it, that money was, for example, 1200 25,000 rupees, $115. Maybe they got $110 or $112, or some few dollars were taken by the agent, those who operated for them. But later on, the banks and the Benazir Income Support Program, they took notice of it, and some people were punished as well. They were caught and they were punished. That's the one thing. Second thing is the bulk aid. Certainly, this time there is no bulk aid coming. As I told that as compared to 2010, when over $3 billion came, this time only $267 million were received for the response, and 9 billion have been pledged, which is a loan, and that again comes into the local channels. The money which should be thrown to the local channels, and that was raised by various local players like Al Khidmat Foundation. This is Jamaat Islami's humanitarian wing. Then there is another Akhwat Foundation. These are the charities which have their local funding mechanism. They have their members who regularly fund them, and they have their own system of accountability for that. So in that way, not a bulk money came up, and not any big scandal emerged. But previously, in previous responses, yes, there were. But there were reports of some irregularities on that count. The question James asked about the cash work well, because it worked well, because as the beneficiaries were duly certified as those who were count under the poverty target, and then those who were not registered earlier, they were later registered after the flood. So the volume of the beneficiaries was made double. So that was the one window which was used, but there could be many other where which are not on the books. There might be some sort of irregularities or corruption might be there. So nobody can deny that. Yes, over to you, Yannick.
Thank you, Dr. Shafkat. And sorry, like yes, like sorry, tech issues. I think we're gonna have to conclude. I'm aware that the room needs to be handed over to other colleagues. There is a follow-up sessions, such as busy schedule at the HNPW. But I think perhaps as a way of concluding today's session, all the issues that came up during our conversation around the type of fundings, different funding streams and channel to fund the response, the constraints around that, how in a government-led response, the nature of the coordination architecture, the role of civil society is shaped, how that impacts the way marginalized communities and groups are included or not in the response. All of those issues are certainly shaping the humanitarian response to the floods in Pakistan, but they're also, for better or for worse, shaping as well the future of humanitarian actions in an area where humanitarian needs are just increasing so much faster than both funding for humanitarian action as well as the operational capacities of the traditional humanitarian aid system. So those issues that we're grappling with in Pakistan certainly speak to or have like resonance way beyond Pakistan. So thank you so much for the learning and reflections around that. Thank you so much, Alice, Asma, Anwar, and Dr. Shafkat for joining us today, for sharing with us and with the audience your reflections, your experience your insights on the Pakistan response. So thank you very much for joining us today, and we will conclude now. Goodbye.
Thank you.
Thank
Bye.
you. Goodbye.
Thanks. Thank you, Yannick. Goodbye.